the things that I used to encourage my patients is get insurance, get NHIF. I left when it was NHIF. I don't know what SHA did because every day SHA, SHA. All I know is that not everyone likes it. But empowering them to get insurance is very important, and understanding that, especially in our setup, that that insurance is very important because it can help you get screening, and if you get complications, it can help you deal with the complications, and you can get access to dialysis or access to a cardiac cath, just because of the insurance. So it's very important for us to be the patient advocate and kind of guide them in that scenario.
Yeah. And I think in the light of ensuring that our patients and clients are able to afford the healthcare, this is where you mentioned when you are here about the NHIF, and if people can be able to enroll into SHA, but it also has to be a system that is working. And I feel so, you know how private insurance can be a bit on the higher side when we are having people in Kenya who are actually living on day-to-day means. Like ile umepata leo ndio hiyo anatumia hiyo siku na imeisha, tunaendea the next one imeisha, yeah. So we've gotten to the point where somebody asks you, like, you're teaching me how to save. What are you teaching me about? I don't even have $1 or $2 to save, right? But if we have a system that is actually working, and which I think can work as long as you said, some things are just put into place, we would actually have a system that works. And most of us would actually end up being on that system. And this other ones would be.
Yeah. And the thing about Kenya, to be honest, I still think Kenya has the most brilliant people I've ever met. And I'm in Canada. But I honestly think Kenyans are so innovative, so creative. Like NHIF was to go to the next level. There was expertise to take it to the next level. This whole things were just because people wanted cuts out of everything. But anyway, the system has to work for many things to happen. And the problem is that it creates a lot of frustration for healthcare providers. Personally, I won't lie. One of the reasons I left Kenya was I was so frustrated with the process. I was so frustrated. And I had worked in public sector. I actually prefer working in a public health sector than private because I feel more fulfilled. But it was so difficult because you're seeing this person who needs an echocardiogram and we'll never get it. They have mamas from here to
Yes.
echo.
Yeah.
A person who needs dialysis, no access. A person who is on dialysis and then the catheter fell, but they only had cover for that one catheter. So now they don't have money for another catheter. So now I was like, what is this? It reached a point where I was like, you know what? I just can't deal with this. So for my own mental health, I had to step out.
Yeah.
That was one of my like drivers out. And so the system has to work better in order to retain healthcare providers who are truly passionate and ready to work and ready to help the people, But we can't lose hope. I think there's still a chance, there's still hope that because we have all the people that it takes for the system to work. So it's a matter of us just taking that step forward and saying, we're in this and things have to change. And I'm looking forward to that day when things will change.